Hi, everyone. Thank you for being once again in Community Chats. My name is Sandra Arevalo, and I'm the Director of Community Health and Wellness at Montefiore Nyack Hospital. Today, we're going to be talking about another very important cancer topic, and that is sleep. So we have a lot to learn about sleep. And of course, we know that sleep is vital, for healing, but not just for cancer patients, but for all of us. It helps us heal, re-energize, be better. And of course, if you have a serious ailment like cancer, it's going to be even more important. So today, our speaker, Samuel Hernandez, he's from Cancer Community Cancer Services. Community Cancer Services, yes?
Cancer support community.
Okay.
Yeah.
Okay, full disclosure, they had another name and we're trying
Yeah.
to get that new name, so I'm sorry about that. But Sam has been with the organization for a while now, and he's, a recurring speaker for us in community chat. So thank you so much for doing that and for helping us bring all this great information to the public.
Thank you so much, Sandra, for having me. I'm really happy to be here. So today we will be talking about sleep and cancer. It's a pre-recorded presentation that'll take about 30 minutes. It has a lot of information about energy, fatigue. We'll go over the different ways in which your sleep might be impacted. And then afterwards, we'll have some time for some conversation and questions.
Perfect. So whenever you're ready, you can start sharing your screen. And this is just a reminder for the people who are joining us live today, please use the chat, the Q&A icons at the bottom of the screen. Start sending your questions, your comments. We're gonna have a large discussion later today after the recording that Samuel is gonna show us. So please feel free to participate. We're eager to hear, your questions and comments. Thank you.
Okay, so I believe that I am screen sharing. Can people see my screen? Yeah.
Yes, we're all good.
Okay, perfect. So I'm going to start it and make it full screen so that we can, see the full extent of it. And if there's any sound issues, you can always let me know. Let's see. You may have seen something pop up that just says that we're recording. Hi, everyone. Welcome to our Frankly Speaking series. Today we'll be talking about sleep, understanding how cancer impacts sleep, and also going over some tips for getting a better sleep. My name is Samuel Hernandez. I'm an oncology social worker here at Cancer Support Community, Greater New York and Connecticut. Our mission is to ensure that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community. All of our services are completely free. We don't ask for health insurance. In addition to these educational series, we also have individual counseling and groups, support groups, which we provide for people who are impacted by cancer in any way. So let's get started. We'll talk a little bit about our overview, which is all things sleep. First, we'll start with the importance of sleep, moving into how cancer and a diagnosis and treatment can impact sleep and what that might look like. We'll move into optimizing your sleep practices that will include tips that we can look at in terms of what we can do to better our sleep. And finally, we'll look at talking with your healthcare team when it may make sense for us to advocate to our healthcare team and check in with them about what they can help us with and the resources that are available for us. Let's talk about how important sleep is. This may sound like an obvious statement, but we'll dig into the ways that lack of sleep or disruption of our sleep patterns, because that's really the important thing, how is sleep changed, can impact us. We know that sleep plays a vital role in our health and health outcomes, as well as our well-being. Getting the right amount of sleep for us can vastly improve our moods, improve our decision-making and problem-solving, impact our immune system, lower blood sugar, and lead to increased levels of appetite. Getting good quality sleep helps our brains work properly, which then improves both our body performance and our body function. Our emotions, which are tied to how our body is doing, are easier to control when we've slept well. We find that we're less irritable and not frustrated or triggered by others as easily. And physically, sleep provides us that time for the body to heal itself. Here's some statistics that we might want to look at. Sleep disturbances are very common in cancer patients. We know that the rate at which cancer patients have trouble sleeping is 2 times the general population. That's the 30 to 75% of self-reported individuals. We see that almost half of all cancer patients are actually concerned. They have some moderate or severe concern with their sleep patterns, with their sleep problems, but only 20% really talk about that worse quality of life. And that can also be because we have other things that are going on, right? There's the side effects from chemo as well, or just a lack of not wanting to talk about it. So the first step in optimizing your sleep practices is really to look at what's different, right? Everybody is different. Everybody has different sleep patterns. Some people may sleep less than others. So it's really important to think about what's changed for us. Some people actually get by on lesser sleep. Some people need more sleep. And it's not only looking at lack of sleep, which we commonly think is a problem, but it's also, are we sleeping too much? And so these are some common ones to look at. Do we have trouble falling asleep? What does wind down time look like for you? And we'll talk about that later. How long from getting in your bed to falling asleep does it take? After you've fallen asleep, is that sleep broken frequently throughout the night? And is there difficulty getting back to sleep once it's disturbed? This is a difficult one to think about, but are you napping throughout the day? How does that impact the sleep that you're getting overnight? Thinking about, if the naps are long, if they're frequent, if we're using that almost to catch up on the sleep that we're missing in the night. Thinking about the impact that sleep has on our brain. Has there been some difficulty concentrating throughout the day? I know this is also maybe coming from a different place. We frequently talk about chemo brain or brain fog. And so it's important to always consider everything together. So you may find that you have difficulty concentrating, but it could be coming from a different place, not just from the lack of sleep or the sleeping too much. Waking up too early in the morning. Again, when we think about waking up too early in the morning, it's always a disruption of a normal pattern. So if this is something that was already happening before, you had a set time that you woke up and it's earlier than other people, as long as it's not a disruption. This may require a partner or someone else to share with you, but physical vocalization during sleep. So loud snoring, breathing, or any gasping noises while you sleep. Sometimes we find ourselves waking up because of snoring, or the shortness of breath, or something like gasp that might wake us up late at night. And so thinking about all these different patterns and these sleep disturbances and how that might be coming together to impact what we need to focus on moving forward. Of course, now we'll talk about how cancer impacts sleep. So here are some common sleep disturbances related to treatment. We know that fatigue, insomnia, and irregular sleep-wake cycle all increase while individuals are receiving treatment for their diagnosis and post their diagnosis. Some brief definitions, because we will go a little bit more in depth into these. Fatigue is feeling overly weak and more tired than usual, not having the energy to complete daily tasks. Insomnia is having trouble sleeping at all or maintaining sleep once you get it. And of course, a regular sleep-wake cycle is our body's pattern being disrupted from the usual. Some examples of things that might keep us awake at night that we'll be going more into as we move through this presentation. It's important to always think about the stress and the stressful thinking and how that keeps us awake at night. One of the tools to think about how to manage that stress and reduce it once we've identified where it's coming from, we can also focus on the things that are in our own control, right? So deep breathing exercises to work on the mental connection to our body and introduce calming moments. We'll have a moment of meditation later on that takes about 5 minutes. Another thing to do is if intrusive thoughts repeatedly are coming in, or if there's something in our environment that's producing a stressful thought, it may be helpful to put it down on paper. So journaling can be a useful activity to ensure that we're noting what is bothering us, what is coming up in our brain, giving it an acknowledgement, and then being able to either address it later on once we have more energy, or set it aside when we realize that it's not important. This list isn't exhaustive. If you're experiencing symptoms that affect your sleep, it's also important to advocate for yourself and speak to your medical professional. Treatment and side effects. Your sleep can and most likely will be impacted by your treatment or medicine. You may see an increase in chronic pain and discomfort, nausea, trouble breathing, and needing to use the bathroom. All of these things can prevent us from getting good quality sleep throughout the night. For common side effects, it's important to talk to your medical team to understand if there are alternate medications that you can take or medications to mitigate those symptoms that are coming up from your treatment. Some cancer treatments, such as chemotherapy, radiation therapy, surgery, bone marrow transplant, biotherapy, are all going to cause fatigue. You'll experience that fatigue because of the stress that your body is being under. And so thinking about how these actual treatments are contributing to the fatigue that you may be experiencing. You may develop anemia if your treatment destroys too many healthy red blood cells. Anemia, you can also develop anemia if the cancer has spread to your bone marrow and interferes with blood cell production or causes you to lose blood. That will also increase your fatigue and lead to less sleep. And of course, any medications that you're taking, always important to know the possible side effects, the impact that they could be having on your body and your ability to sleep. Hospital stays. We may not always think about this, but this is always putting us in an unfamiliar environment, and it's going to disrupt our routine. It's not an ideal place to get a good quality rest. There'll be noises all throughout the night, medical equipment with lights on or making noises as they monitor, hospital staff who might come in to check on you or who can be heard checking on other patients, and a generally unfamiliar surrounding. Some tips for mitigating that, and also for thinking about mitigating it when we're in an unfamiliar location, is to bring any comforting items from home, things that we know provide us with comfort. Keep the blinds open during the day to maintain a normal sleep schedule. So we're going to talk a little bit later about routine and how routine can help us to establish that connection in our brain of what our sleep pattern should look like. If we can, ask for any medication or treatment to be administered during the day so it's less disruptive to the sleep that we're getting at night, and then continuing to follow any good sleeping habits that we've developed in our home in that more comfortable environment. Of course, we have to acknowledge the pain that comes along with cancer, a cancer diagnosis and a cancer treatment. Cancer patients will experience pain and chronic pain that may keep them from sleeping well. Some common sources of that pain could be from the cancer itself, from any surgeries that may have created that pain. There may be phantom pain, thinking that a pain exists that cannot be easily identified. There will be treatment side effects, either side effects of chemo and radiation, some common ones such as neuropathy, mouth sores, skin burns, scarring, or other procedures and testing throughout this entire process that is putting a strain on our body. All of these are putting the body through a great deal of stress, and we need to acknowledge them as being a source of pain that might create a lack of sleep. Pain may wake you up in the middle of the night or prevent you from falling asleep in the first place. It's really important in this situation, wherever the pain is coming from, to identify it, and then also to have a conversation with your healthcare team. There are palliative or pain management options. There are integrated medicine options. It may be that the medication is changing, or it will be changed, or can seek out alternatives. We know that lack of sleep and lack of comfort in our lives can lead to poorer health outcomes and generally contribute to worse mental health and well-being. So it's really important that if we're experiencing pain, that we don't just take it on and that we don't just deal with it, and that we make sure that we're talking to a medical professional about it as well. Fatigue. It's important to understand that fatigue is common and it can vary in severity from person to person. It usually does come on suddenly. It's not a result of activity or exertion and is not relieved by rest or sleep. Fatigue is less precise, less cause and effect. We don't know where it's coming from. Sometimes it may be a cumulative effect as well. It's a daily lack of energy, an unusual or excessive whole body tiredness that doesn't feel relieved by sleep. It can be acute, lasting only a month or less, or chronic, lasting from 1 month to 6 months or even longer. Fatigue can have a profound negative impact on a person's ability to function and quality of life. A little bit of statistics. So 4 out of 10 cancer patients indicate fatigue symptoms worse than the national average. And half of those, again, report that they were moderately to severely concerned with their sleep problems related to that fatigue. These are all the sources of fatigue in our bodies. I won't read all of them, but you can see how very common aspects of our cancer diagnosis and treatment can lead to increased fatigue in cancer patients. Some of them we already did talk about, but also our emotions when they are overwhelmed, when we're experiencing heightened emotions, can also contribute to a feeling of fatigue. Our lack of nutrition or lack of appetite. Lack of exercise can also make us feel more fatigued, which has that compounding effect of contributing to lack of sleep and then making us feel even more fatigued. We're going to talk about how to manage fatigue because that's really important. To combat fatigue, we need to give ourselves permission to focus on our own needs and what we need to do to achieve self-care. It may require you to start doing things on your own. You might try to conserve your energy. Save your energy for your most important activities. Keep track of the times in which you feel the best, and whatever important activities you need to accomplish, do it during those times. Making sure that you're always asking for help when you need it and getting that support so that it's not compounding that fatigue. Another thing to do is maintain the energy that you do have. Drinking lots of fluids and water, eating well can help keep your energy reserves up. If we limit or avoid caffeine and alcohol, if nausea and vomiting make it hard to eat, that's when we want to talk to our doctor about those side effects to help us with any possible options that may be available to us. It may be really hard to motivate ourselves, but it's really important to get moving. When you feel up to it, again, thinking about your energy levels, light exercise throughout the week may help you preserve your energy level. Exercising regularly as you start treatment, as you move through it, it develops that routine, which then helps us to prevent fatigue during treatments or during times of stress. Other things that we can do is relaxation techniques, whatever works for us. There are breathing exercises, body scans, and finally, maybe some medication that can help to relieve stress and boost your energy. And that one you're going to want to check with your healthcare team about. Mental health. Many people will experience cancer mental health changes, including distress, depression, and anxiety. Really important to know that a lot of the symptoms for depression and generalized anxiety disorder, which can be more of a clinical anxiety level, are related to lack of sleep and do interact with a lot of the things we've already talked about. Insomnia and other sleep problems have that impact on our emotional well-being. Our emotional well-being being impacted is going to impact our quality of life. 49% of all respondents with a cancer diagnosis were at risk of clinically significant levels of anxiety. As I mentioned, there's a lot of crossover between what lack of sleep is making us feel and what heightened anxiety and heightened depression are also going to make us feel. So also 40% were again at risk for clinically significant levels of depression. Some tips for our mental health and how we can best preserve it, in addition to the self-care that I was talking about previously in the fatigue section. We want to address any mental health changes. And once we start to address those, once we either note it down or we talk to someone about it, that can lead to an improved sleep quality, which then leads to improved health. So then we have on the opposite end that snowball effect of actually tackling the things that might be contributing to our lack of sleep, and then our lack of sleep, which contributes to worsened outcomes, being improved as well. Anytime we see severe symptoms, it's always really important to talk to either a clinician if it's mental health concern or your healthcare team. This is a brief writing exercise. If you don't have materials with you, you can sit with the thoughts that are brought up for you. We aren't going to share at this moment, but if you'd like, you can share after we wrap up the slide presentation. As we've gone through this presentation, what emotions and feelings are being brought up for you? How is your relationship to sleep? And does your relationship change from day to day? Do you notice patterns in your relationship with your sleep? And finally, think about what hopes you have for your sleep patterns and how you might get to those hopes and practices. What do you need to do to get yourself to that space? Just a brief pause, and then we'll move to the next exercise. So now let's talk about tips. Changing our health practices, acknowledging what needs to be changed in our environment and the environmental factors that are around leads to improved sleep hygiene. The next slide will talk about ways in which you can change your practices and how that might improve your sleep. These are general tools, and we'll look at them in detail in the following slides. You can set up your sleep schedule, follow a nightly routine, cultivate healthy habits, and improve your bedroom space. What does it look like to set your sleep schedule? So having a set sleep schedule normalizes sleep as an essential part of your day and gets your brain ready for getting the full amount of sleep that you might need. Having a fixed wake up time and keeping to it helps you to keep and also keeping that schedule on the weekends or when you might have days off is a beneficial sleep practice that normalizes that as part of your routine. After you've scheduled your wake up time, calculate what a bedtime might look like based off of that and how much energy you know that you need to comfortably wake up at that time and what you need to do then to achieve that. Don't do it all at once. Make gradual achievements to your sleep times and do what feels good for you. If you try to do it all at once, you're going to set yourself up for failure by making yourself miserable when you wake up or need to go to sleep at a time that is different than what you're currently doing. Try to reduce napping. And when we talk about that, we're talking about frequent naps. We're talking about long naps. Those may feel good at the time, but it is leading to having more difficulties having better and deeper sleep at night. If you need to nap, try to keep them short and limited to early afternoon. As part of setting a sleep schedule, setting yourself up with a nighttime routine can increase success. It's really important to keep your routine consistent. Follow the exact same steps each night. Include things like putting on your pajamas and brushing teeth, the basic things, which reinforce in your mind that those are part of your bedtime. You might want to budget time for yourself winding down. This can be 30 minutes, it can be 15 minutes. Take advantage of whatever puts you in a state of calm, such as soft music, light stretching, reading, and or relaxation exercises. One thing that you can also practice with the budget time is doing it separately from your bed. May want to create this, you may want to create this space in your mind to acknowledge that your bed is for sleeping. It's not for any other activities. And so thinking about how you can budget your winding down time in a separate space that is also comfortable. And then when you're done with that winding down time, just moving directly to sleeping in your bed. Dim your lights during that time. Dim your lights as much as possible. Try to keep away from any bright lights because they will hinder the production of our body's natural melatonin, which is a hormone that the body creates to facilitate sleep. Unplug from electronics. This is a really hard one to do in our day and age, but if we build in that 30 to 60 minute pre-bed buffer time, we can also make that device free if possible. Cell phones, tablets, and laptops cause us mental stimulation. It's hard to shut off, and they also generate blue light that may decrease melatonin production. One thing to consider, which people have told me in the work that I've done that they've done, is to don't charge your phone at night. Don't turn it off completely. If there's a concern that you need to be connected to for some reason, you can always turn it off for certain hours. You can set it to wake up so that you still get those notifications. But if you can, move away from that and just completely turn off your phone at night so you can create some distance from yourself from a device that is also contributing to lack of sleep. If you need to, you can always get up and try again. So if you find yourself in bed and you're not falling to sleep, it is really healthy to have that mental connection between being in bed and actually being asleep. Your body and your mind appreciate that actual connection. So if after 20 minutes to 30 minutes, it hasn't worked, you can get up and stretch, you can read, do something else calming, again in low light, before again, trying again to fall asleep. If you're experiencing any pain though, and are prescribed a pain medication, you can take this medication 30 minutes to an hour before bed, as it works with your schedule, if possible, to reduce any pain that might be disruptive while you're trying to sleep. Some healthy habits in general to have while we're thinking about our sleep practices. We want to go to bed when we're sleeping. That seems really obvious, but one thing we're trying to do with our routine is create the idea that we're in bed when we're asleep, and when we're sleepy, we acknowledge that and go to bed. So try not to keep ourselves awake beyond that sleepy time. Stay active during the day. Create a routine for daily activities. Our brain really likes those reinforced daily activities. So it's really helpful for us to know this is what's happening now, this is what will happen then, as much as possible, creating that routine. We want to consider reducing caffeine and alcohol consumption, especially in the afternoons and evenings when it becomes more of a stimulant and might be contributing to why we're not sleeping. Reduce any eating and drinking before bed, again, for the same reason. It's very stimulating. It puts our body into a mode of processing everything that we've consumed. And then exercise during the day, at least 4 hours before bedtime. We don't want that high from our exercise to then also contribute to why we're not sleeping. Restrict any other in-bed activities. So again, if you need to restart, you can always get up, you can do that. If you can create a separate space that is comfortable for you to do those calming activities, that's always extremely helpful in creating in our mind that space, that sacred space of our bed for sleep. Our physical environment. So we thinking about our actual bedroom. Is it a source of frustration, of stress, of anxiety? How is our mattress? Is it comfortable? Do we like the pillow that we have? Thinking about the actual things that we're surrounded by as we try to sleep. If possible, set a cool yet comfortable temperature. 72 is oftentimes recommended for the ideal sleeping conditions for humans, but if it doesn't work for you, just find what works for you and try to maintain that. Block out any light that might be coming in. It may be very tempting to have a low light to keep with us just in case, but just make sure to reduce that if possible. And if there's any noise that's coming in, we might want to drown that out as well. I have a 5-minute mindfulness exercise that we're going to be doing. It's focusing on our breath, very common tool that we do in mindfulness just because it is so readily available for us. Mindfulness is an activity to help try to get to a calming and restful state. Oftentimes we do find that thoughts will intrude as we're engaging in the mindfulness activity. As I previously mentioned, you can always note those thoughts. You can acknowledge them as they come up. You can either write them down if it's important to you, or you can simply vocalize to yourself, I know that this thought is coming up right now. I don't have time for it. It's not the space for it. I will get to it later. And that acknowledgement can help us to move beyond that. So this exercise should only take 5 minutes. It's called finding the breath. What we're going to be doing is gently finding the breath in our body. There's nothing to figure out. There's no problems to solve. And there's nothing special you need to do. You're training the mind to be with one experience without distraction. As always, with all of our activities, we find a comfortable position for the body. Sitting is recommended as it keeps the body a little aware. You can do this in your bed when you're falling asleep. You can do it as well. You can also always try laying flat on your back on the floor if that helps, or even standing. This exercise is extremely flexible. You have to find what feels comfortable for you because we're trying to focus on our breathing. So any distraction in our bodies that may be coming up, we want to try to minimize those as much as possible. Gently allow your eyes to close. If you're more comfortable with the eyes open, try softly gazing at the floor or the ceiling, depending on your position. Allow the eyes to relax and rest on one spot. The idea is to minimize distractions in your practice. Now you're going to bring your awareness to your abdomen, relaxing the muscles there, seeing if you can feel the natural rising and falling. Imagine the body is breathing itself. From the navel around to the obliques, notice the movement with each breath. Take a few deep breaths like this. Move your awareness up to the chest. As you inhale, tune into the expansion of the lungs and the rising of the chest. As you exhale, feel the contraction and movement. See if you can follow the feeling of the breath from the beginning of your inhalation through the end of your exhalation. Now bring your attention to the nostrils. The feeling of the breath may be more subtle here. Try taking a deep breath to see what is present for you. You may notice a slight tickle at the tip of the nose as you breathe in. You may notice the breath is slightly warmer on the way out. Rest your awareness on the body breathing in one of these three spots. When the mind begins to wander, refocus on the direct experience of the breath. Continue to observe the breath for a minute or two. Wrapping up this period of practice, bring this awareness with you into your daily life. Stay in touch with the breath in your body to help the mind remain present. As we come back to this space, it's helpful to acknowledge that not everybody has a good relationship with their breathing. So if breathing exercises don't work, you can always find other ways to connect to your body in a way that can help you to achieve that calm and that focus, free from distraction from your environment. So now we'll move into talking to your healthcare team and when you should do that. 44% of cancer patients reported a sleep problem in their previous month, but only approximately 17% communicated the problem to their doctors. I'm going to acknowledge here that the medical system can be very complicated and not always the most approachable, but it is really important to connect with your medical provider about the side effects of the treatment that you're experiencing. If you are experiencing a lack of sleep, these medical experts may oftentimes have recourses for you, whether that's changing your medication or providing you with alternative medication or treatments that might be helpful to you to help you deal with that new problem of lack of sleep or disruption of sleep. Here are some questions for what you might want to ask your medical provider, just some examples, and some that are very basic. Why am I having trouble sleeping? Is it related to the treatment that I'm receiving? Is it related to the medication? Is that a common side effect? Are there other areas that I should be looking at related to my diagnosis and treatment? What steps do you recommend that I take to sleep better? Would you recommend a sleep therapist who could help with the problems I'm having? And would any sleep medicine be advised for me? Some solutions when the sleep issue may get bigger than we want it to. One is to seek out counseling. So we do know that there's a connection between our body and our mental health and our brain. And so if there's something in particular, especially with any intrusive thoughts, anxieties, or stressors that is routinely keeping us up at night, it may be really important for us to connect with a counselor. Something that can be done at Cancer Support Community with us, or we can, connect you with somebody as a referral. There is also relaxation therapy, so something more niche and specific to look into that may be able to help you to get to that point of being able to relax without distraction. Finally, sleep aids are very common. We do find that cancer patients use a sleep aid in some way to help them with their lack of sleep or sleep disruption. And so that one you do want to talk to your medical team about how that may affect you, but also interact with the other medications that you might be taking. Some additional resources that are both available from us and then also others. We have a cancer support hotline helpline. So if you do need to call, they are available Monday through Friday, 9 to 9 p.m. They have local connection to local resources, connection to national resources, professional counselors who are able to assist you. They also do have weekend hours, which are not listed here. 9 to 2 p.m. So if you need to connect with someone on the weekend, you're also able to connect and call with them. As part of our helpline, we do have the additional services of Open to Options, which is a wonderful program which you can speak to a professional for 1 hour around a particular medical concern that you may have. Something, only 18% of cancer patients brought their lack of sleep, even though it was a concern to their medical professional. And that could be oftentimes because we don't know how to bring it up. And so thinking about that conversation, Open to Options will give tips on how to ask the appropriate questions. and work you through what's the best way to navigate the healthcare system to get the idealized response for you. Our Cancer Experience Registry is an online forum in which other individuals who are experiencing cancer, who have gone through cancer, or who have a loved one with cancer will be also sharing their experiences on the forum. So there's a lot of different topics available. And finally, our Frankly Speaking About Cancer program, like this one, which provides different educational topics and different ways in which we can manage this different stressors related to our cancer diagnosis and treatment. We have a Living with Uncertainty program that we also talk about in terms of the thoughts that may come up as we get our cancer diagnosis and move through treatment. So here's my contact information. Thank you so much for attending our Frankly Speaking About Cancer presentation today. I'll be closing out the presentation in a minute and stopping the recording so we can have some time for questions. This is my information. Our main line is here, 914-644-8844. So you can always reach out to our general line. We have a small staff, so everybody's equipped to answer any questions. If you'd like to reach me directly, my extension is here as well. My email is here if you prefer that. Any questions that you do have, you can always reach out to me. Thank you again for taking the time to be in this recording. And I hope that if you do have any questions or if anything does come up for you, you reach out to me.
Well, thank you so much, Samuel, for this presentation. You know, I was thinking as I was listening, like, some of us just take sleep for granted, and we don't really know what goes on, you know, and so many factors that can affect our sleep. We either sleep or don't sleep, and especially, you know, for patients with cancer, this is truly remarkable that they have to really, you know, make sure that they're getting a good night of sleep, but so do we all. So thank you so much for your presentation. And at this point, I would like to ask our attendees, if you have any questions, please send them to us via the chat or the Q&A, and I'll be really ready to read those questions to Samuel. Are there, you were, towards the end, you were showing some resources. Are there any, for example, apps? I see that there are a lot of apps nowadays that have like meditation music, or, you know, I guess resources to help you sleep. Do you have any of those in mind that you recommend?
One thing I would recommend a lot, there's like, for example, the Calm app, and those will have built-in meditations, and that it'll track your progress and how often you do it. But that may be part of a paid service, and there's like a free portion. So what I would honestly recommend is finding, using YouTube, using the internet to find clips. There's meditation for sleep, even things like soothing music, right? And so if you don't want somebody talking to you as you try to go to sleep, listening to some soothing or calming music can also be really helpful in that situation.
Yes. And I have a comment here. Good afternoon. I'm multitasking and was unable to write the email from Mr. Hernandez. Can you please share again? It was a fabulous presentation. Maybe you want to just say it loud and put it in the chat. Also,
So, yeah, I'll drop it in the chat. It's my first initial, then last name, S. Hernandez, at cscnyct.org. It should be in the chat. Hopefully everyone can see it.
Thank you so much. Okay. No, I don't see any more questions for now. Any last thoughts, Samuel? I know that you deal with patients with cancer every single day. So any last thoughts related to the topic of the day?
I will say, and I didn't mention this in the presentation, but we need to also try not to be so hard on ourselves, right? Changing our sleep pattern, changing our routine, those are really hard things to do. And it's really tempting oftentimes when we're not feeling well to go to these soothing methods of being on our phone or watching a video or, doing things that can be disruptive. And that's okay. And if it works to make us feel better in that moment, that's perfectly fine. We can reset and try again another day, right? It's about steadily making those changes so that eventually we're getting the sleep that we need.
Perfect. Well, thank you so much for this presentation. And again, very soon I will be uploading the recording in our community chats, Montefiore Nyack community chats page in YouTube. So if you want to see this recording again or share it, please do so for this and many other community chats. And I guess that's all for today. Thank you so much. I always enjoy learning about cancer from you, Samuel. So thank you for your presentation. And I will see you next week. Thank you.
Thank you so much for having me.